Welcome to the NEOS knee replacement information video. I'm Ben Block, Head of Service and Knee Surgeon here at City Hospital. The purpose of this video is to highlight some of the most important messages you need to know about before your upcoming surgery. Recovering from your joint replacement surgery has changed a lot over the years. We know the sooner you get up and walking after your surgery, the better your outcomes will be. To help you do this, we have developed a pathway using the expertise of hospitals in this region and across the country. This should allow you to get back on your feet sooner and return home to do the things you enjoy on the day of surgery or the morning after. Replacement surgery involves resurfacing the ends of the femur, that's the thigh bone, the tibia, the shin bone, and if necessary, the underside of the patella, which is the kneecap, with man-made components called prostheses. Please refer to our patient information guide for more details. A knee prosthesis is made up of several parts. The femoral component resurfaces the femur, the thigh bone, and is made of a metal alloy. Special non-nickel components are available for nickel-sensitive patients. The tibial component is a flat metal platform. A plastic bearing sits between the tibial and femoral components to absorb the shock and to keep the two surfaces aligned. Although the patella, or kneecap, is not always resurfaced, the patella component, which is made of plastic, replaces the worn cartilage on the undersurface of the patella. Some patients may be suitable for a partial knee replacement rather than a full knee replacement. A partial knee replacement simply resurfaces one section of the knee, and that is suitable for patients who have osteoarthritis in only one area. The choice of a partial knee replacement or a total knee replacement will be discussed with you prior to you being listed for surgery. The recovery, however, is fairly similar. Total knee replacement is a very successful operation. However, it does carry potential risks, which largely relate to either the anaesthetic or the surgery itself. Rest assured, however, that most people recover well and without major problems to move and bend their knee as before. You should have been provided with a patient information guide, which includes all the information that you require prior to your surgery. It is important that you have taken time to read the guide and to attend all the appointments before your surgery.
We are introducing a patient app in autumn 2023, which will also have all of these resources easily available. It is important that you have arranged transport to and from hospital for your surgery. You should aim to be in the best overall physical and mental condition possible to help achieve the best results from your surgery. The fitter you are before your surgery, the less likely you are to have complications during and after your surgery. You should seek to make some lifestyle adjustments, such as reducing alcohol intake, stopping smoking, keeping as mobile as possible, and losing weight. Many of you will have been waiting a long time for your operation. This may mean that you are not as healthy and as mobile as you would like to be. Research shows that increased physical activity before an operation can reduce complications and the length of stay. We understand that you may be unable to comfortably exercise the leg due to be operated on, but we need you to exercise the rest of your body. You will be given an exercise leaflet in pre-op with exercises that are crucial in preparing yourself for surgery. Preparing assistance for after your surgery. You have probably been living with joint pain for some time before your operation and will already have some ways of adapting to certain situations at home. However, when you are recovering from your operation, you may feel you want some extra help with general tasks, cooking, shopping and cleaning initially. This is not essential, but if you feel you want additional support, it's up to you to organise it with friends and family before your operation date. To ensure that your return home is successful and safe, you should have someone at home with you for the night of your surgery. Care agency support. Very few people require professional care support at home. If your personal choice is to have this help, you must arrange this privately. The NHS can only provide professional care based on specifically assessed need and cannot arrange convalescent care. Some patients expect to be able to stay in hospital for long periods for rehab or to improve mobility. The NHS now has a Home First directive, and patients are encouraged to rehab in their homes if appropriate. Prepare your home. Preparing your home environment in advance is helpful for when you get discharged. Prepare your home checklist. Consider adaptive equipment installed, if advised by occupational therapist. Space cleared to allow good access around your home. Position everything to hand on an easy reach surface. Remove all loose rugs and wires. Stock up on groceries and toiletries and arrange for someone to help you restock if required. Prepare or purchase frozen meals in advance. Arrange for assistance with meals and light housekeeping until you feel stronger. On the day of surgery, you will be admitted to the theatre admissions lounge, where you'll be seen by a nurse, healthcare assistant and the surgical anaesthetic team. Please note, there may be a long wait for your turn to go to theatre. Your skin will be checked for existing damage, which helps us to identify those who will need frequent skin checks post-op. Please bring in your information pack and just a small bag of belongings. This is just the items you will need for the day, plus any medicines you currently take. Please leave any controlled drugs at home, such as morphine, pain patches, gabapentin, pregabalin, tramadol. Anaesthetic. The anaesthetist will help manage your pain during and immediately after your surgery. This means providing the most appropriate anaesthetic for you and prescribing pain relief medication after the operation. Hip and knee replacement surgery is done either under spinal or very occasionally general anaesthetic. A spinal anaesthetic is the preferable option because it avoids risks from general anaesthetic, including nausea and vomiting after surgery. You are also less likely to bleed during surgery and need a blood transfusion. You can get up and walk much more quickly. A spinal anaesthetic will also improve pain relief after surgery, meaning that you are less likely to need strong painkillers after the operation. You will feel less confused and groggy after surgery and will be able to return to eating and drinking sooner. Spinal anaesthetic involves injecting local anaesthetic and other painkillers into an area in the middle of your lower back so that it can reach your spinal cord. This numbs your nerves to give pain relief below the waist. You may wish to listen to music for distraction. You will be standing within an hour of the spinal anaesthetic wearing off. Observations. Nursing staff will monitor your blood pressure, pulse and temperature during your stay on the ward. Pressure care. Skin checks will happen on the ward. Be prepared for this happening as frequently as every 2 hours. Regular position changing is essential to maintain healthy skin and prevent any further breakdown of skin. Just like any other surgery, joint replacement surgery is painful. The first few weeks can be a difficult period. However, it is important to stay active and keep up with your movement exercises. We will be giving you strong pain relief medication. However, you should expect there to still be mild to moderate pain on movement. It is not going to be 100% pain-free. Mobility. The therapy team or nursing staff will help you to stand within an hour of return to the ward. You will mobilise with a frame or crutches as soon as possible on the day of the surgery. You will be encouraged to get dressed and move around the ward. Please remember to bring your information guide into hospital so you can refer to the exercises. Discharge. Once you've reached certain milestones in your rehabilitation process, you will be discharged to continue your recovery at home. Prepare to be discharged on the day of the surgery, or, if there is no one at home, or if there are medical reasons why you need to stay in, you will be offered a bed to stay overnight and you will be discharged early the day after. Let's hear from Gary, who had a double joint replacement.
Hi, I've had 2 joint replacements. I'd just like to say I feel so much better for it. You're not in hospital long, and when you get home you feel so much better. The great thing is you can relax, you can take things at your own pace, and you can sleep a lot better. I know a lot of people worry about going home after the operation, but I would just like to say it's great. You're in your own environment, you feel more relaxed, and yeah, it's just so much better. So do not worry about going home and leaving the hospital.
Taking care of your wound is an important part of recovery. Your surgeon may have used clips or stitches to close your wound. You may have a dressing or glue on the wound with a mesh. Do not remove the dressing or mesh unless you have been instructed to do so. the nurse at your GP practice will need to remove these at 10 to 14 days after surgery. If your surgeon has used absorbable stitches and glue, no further action will be required, but we still recommend that you are seen by the nurse at 10 to 14 days to confirm that the wound has healed. Prevention of blood clots and deep vein thrombosis. You may have to inject yourself with blood thinning drugs, or alternatively, tablets such as aspirin will be provided. There are steps that you can take to prevent blood clots. Regularly perform your exercises, stay mobile, take your anticoagulation medicine as directed, stop smoking. Infection control and antibiotics. Infections after joint replacement surgery can be serious. Your healthcare team will take steps to minimise the risk of infection, which will involve a limited course of preventative use of antibiotics around the time of your surgery. There are contact numbers in your information guide in case of any complications. Warning signs and symptoms you need to look out for: a fever, increasing redness or oozing from your wound, increasing pain that does not respond to your medication, pain or swelling of your calf that is not relieved by elevation, trouble breathing or shortness of breath. At home. Even though you may be discharged after your operation, you are not alone. There is always someone available whom you can contact for advice. You will be given information about who to contact should you require any help. You will receive a follow-up call after discharge. It is important that you continue to follow the recovery advice in the guide regarding your exercises, walking, activity, driving, and attend any outpatient physio appointments.
So in summary, read the patient information guide, do your exercises, keep mobile, and remember the safest place for you to recover following your surgery is at home.